Good afternoon, everyone. This is the only slide I have, so if it's hard to read, you can scan the QR code and pull it up on your phone. And getting right into it, my name is Thi. I'm a fourth-year PhD candidate at the Yale School of Public Health. Gender-based stigma is defined as social devaluation, prejudice, and discrimination experienced because of one's gender. It has been linked to adverse health outcomes such as depression, anxiety, higher viral load, and lower self-esteem. Gender stigma consciousness, on the other hand, is an individual's own heightened awareness and sensitivity to the stigmatized status associated with their gender and has not been previously examined among older women with HIV. Using data from a sample of 235 women aged 50 years and up from the Women's Adherence and Visit Engagement substudy of the WISE cohort, we found that higher gender stigma consciousness was associated with better overall cognitive functioning, specifically in the domains of executive function, processing speed, and verbal fluency. It was also positively associated with attention, learning, memory, and fine motor function domains, though they were not statistically significant. These findings were contrary to our original hypothesis and warrant further theoretical and empirical investigation into the directionality and mechanisms linking gender stigma consciousness with cognition among older women with HIV. For example, it's possible that stigma consciousness is a motivator of action in the face of discrimination, and women high in stigma consciousness may reject or react against perceived gender bias by engaging in collective action to combat against and reduce societal stigma against women aging with HIV. And then this collective action in turn may connect women with HIV to supportive social networks that could be beneficial for their cognitive health. Thank you.